Hello students, welcome to Pharma Syndrome YouTube channel, and today our discussion is on clinical applications of the beta receptor blockers. Clinical applications of beta receptor blockers. So beta receptor blockers are nothing but these drugs blocks the beta receptors in the sympathetic nervous system. Okay, so regarding the classification of beta receptor blockers with excellent mnemonics, so please go for our previous video on beta blockers. Nothing but drugs acts as a beta receptor blockers. So let's come to our discussion. Here it is: clinical applications or indications or therapeutic uses of the beta receptor blocker, and the mnemonic is here ECG and HAP. So always don't depend on the mnemonics. Mnemonics is for our entertainment purpose as well as our interesting and focus purpose. So mostly based on the mnemonics you can study, but understand why these are useful in this condition, what is the reason. Like this you can understand. So mnemonics for our general purpose only, so don't hardly depend on the mnemonics. So regarding its mnemonic, first letter is E. So the beta blockers are used in essential hypertension, also essential tremors. So essential hypertension is also called as primary hypertension. So what is the meaning of essential or primary hypertension? Generally there is a unknown reason. So the general cause is not known, but the hypertension should be immediately treatable. And these drugs are also useful in essential tremors, especially excess sympathetic activity may causes unusual muscle contractions in the skeletal muscle. So that is because of sympathomimetic action. So if you want to reduce this essential tremors, you have to block the sympathomimetic action, that is blocking of beta receptors, especially skeletal muscle contains beta 2 receptors. If you block beta 2 receptors on skeletal muscle, the unusual muscle contraction will be reduces. And the beta blockers are useful in the cardiac arrhythmias and congestive heart failure. So cardiac arrhythmias, nothing but arrhythmia, abnormality in the rhythm. So this may be higher arrhythmias, tachycardia, maybe lesser arrhythmias, bradyarrhythmias. Tachycardia means more than 100 beats. Bradycardia means less than 60 beats. So beta blockers are used in case of tachyarrhythmias. Why? Because tachyarrhythmia is because of overactivity of sympathetic nervous system. Here beta blockers reduce the overactivity of sympathetic nervous system and reduce that excess heartbeat 100 to the normal heartbeat. Congestive heart failure. So beta blockers are used as a supportive agents in the congestive heart failure along with other drugs like digitalis, angiotensin receptor blockers, like that, used as a combination. Next, glaucoma. Especially beta receptor blockers like non-selective beta receptor blocker timolol frequently used in the glaucoma. So timolol is a non-selective beta blocker, especially it having morpholin as well as thiazole ring. Thiazole ring it contain as well as morpholin ring. Morpholin ring means a 6-membered heterocyclic ring with oxygen nitrogen. Morpholin means 6-membered heterocyclic ring with oxygen as well as nitrogen. Next, hyperthyroidism. I hope when you are studying regarding anatomy of the thyroid gland, in hyperthyroidism there is an increased sympathetic activity. In hypothyroidism there is a decreased sympathetic activity. In especially in hyperthyroidism there is an increased heart rate. Why? Because if thyroid hormone levels are more in the body, the sympathetic activity will increases, the heart rate will be increases. So to counteract that sympathetic action, we have to use beta blockers in the hyperthyroidism. Why? Because hyperthyroidism is because of excess sympathetic activity. It also leads to increased heart rate. That's why in case of hyperthyroidism, beta blockers are useful. So that's only I written here. Propranolol decreases sympathetic stimulation and blocks peripheral conversion of T4 to T3. I hope you know T3 form of the thyroid hormone is active form. That's why T4 generally converts to the T3. Next letter is A. So beta blockers are useful in the prophylaxis of angina pectoris. Prophylaxis of the angina pectoris. What they will do? Reduction of the oxygen requirement of the myocardium. So generally angina means there is a chest pain. There is an abnormality in the chest. Nothing but related to the cardiac system. Especially that is happen because of the heart requires more oxygen, but the body unable to satisfy that demand. So then what will happen? The heart work increases and it leads to more workload on the heart. That more workload on the heart may lead to angina pectoris, chest pain. That's why there we have to reduce the oxygen requirement of the heart. Then only the situation will be normal. And apart from that, the beta blockers are also useful in the myocardial infarction. And apart from that, the beta blockers are also useful in the anxiety, especially propranolol. Propranolol is a anxiolytic drug or anti-anxiety drug, especially anxious behavior, tension, fearness is common in the people. If the tension, fearness is becoming more severe, then nothing but the reason is excess sympathetic action also may causes increased anxiety in the person. That's why to control that anxiety, we have to counteract sympathetic action. Next, alcohol withdrawal symptoms. If suddenly the person want to remove alcohol addiction, he wanted to stop alcohol habit of daily drinking. So he should not remove suddenly. He have to remove slowly. If he up to from last 4 or 5 years he drank up to today, but suddenly he want to stop tomorrow, then what will happen? Already his body habituated to alcohol. If suddenly he stops, means what will happen? There is some withdrawal symptoms, some side effects are occur in the body. To counteract that side effects, beta blockers are useful for the alcohol withdrawal symptoms. To control alcohol withdrawal symptoms, the beta blockers are useful. Apart from that, the beta blockers are also useful in the prophylaxis of migraine and also pheochromocytoma, that is tumor of adrenal gland. So especially if a tumor to the adrenal gland, then the catecholamine secretion is more. The catecholamines release will be more. If catecholamines release will be more, sympathetic activity will be more. That leads to increased hypertension. So to counteract that hypertension, we have to treat the tumor of the adrenal gland. The terminology is pheochromocytoma. So these are the different clinical applications of the beta receptor blockers. Okay, thanks for watching and keep following our channel for more interesting concept and mnemonics also. Thank you. All the best.